Friday morning, everybody. This is Lynn Schrader with KHI Solutions. Here we are for our July edition of Patient Protection and Affordable Care Act updates for agents. So going through our agenda this morning, we're going to talk, and just a reminder of the ACA timeline. A lot has changed, and maybe you joined us last time, but maybe not. It's a good reminder. We're going to talk a little bit about the U.S. Supreme Court decision that just came down, small business tax credits, the orientation period, and Wellmark announcement, as well as some fall training. This probably won't go a whole hour today, but thanks for joining us anyway on this Friday morning. As you recall, the whole "if you like your health plan, you can keep it" idea, and that one, we know that all of those dates got pushed out, that individuals who are non-grandfathered keep their plans clear through January 1 of 2016, that groups 51 to 99 have delayed the ACA compliance until October of 2016, and the groups 100 plus just until January 1st of 2015. And then the coverage limits in terms of how many full-time employees they need to cover has been dropped for that year down to 70% of full-time employees, and then it goes up to 90% in 2016. So just a reminder there. This was the big news that came down since our last call last month. And when the Supreme Court ruled that the contraceptive mandate violated the Religious Freedom Restoration Act of 1993. So you should know that, right? And they talk about this closely held corporations, and really what they're referring to there are privately held companies. So they are not referring to those that are publicly traded. But this was a big decision that came down. And if you guys recall from our prior conversations and other healthcare reform training that we've done, the Catholic Church got an exemption, and then that allowed all other religious entities and nonprofits to be able to take advantage of that exemption. But Hobby Lobby was the one that brought the case as a privately held for-profit corporation. So anyway, there's more. As you guys know, I touch on some of the things. If you need more information or want more information, we've got it for you. Just get a hold of one of our staff, drop me an email, because this is at least giving you the high level so you know. And now there'll be other companies that are privately held, and you deal with those, I'm sure, every day, that may have the same religious belief in not wanting to offer contraceptive coverage without copay. And that's what's at issue here. So those groups don't have to offer it now. Anyway, okay, so I'll go ahead to the next slide, and just so you kind of hear about the key highlights of the ruling. And it really, in what they're talking about, it burdens the exercise of religion in violation with that, again, closely held corporations, and it doesn't address the publicly traded companies, as I mentioned. And the existing religious employer exemption is the other one that's already on the books that I just referred to. As you guys know, too, copies of these slides, as well as a recording of this webinar, will be on our website, and usually we get it posted by late after Friday or first thing on Monday morning. So if you need these slides or anything, it'll be available then. The next thing I want to just mention is the small business tax credit. And you guys, I know, have known this, but this is a good thing to bring up right now during the summer to talk to companies if you haven't. And remember, it is the fewer than 25 full-time equivalents, their average annual wages below $50,000 per full-time equivalent, contribute at least 50%, and knowing that owners are excluded and are not counted either in the number of employees, wages, or the premium contribution amount. Tax credits obviously can't be any larger than their actual income tax liability. What we've done is I just kind of did a little sample for you. So when you're talking through with your small business employers, and by the way, we put this estimator out on our website, on the khiagents.com website, and on the healthcare reform page. So you can get to this, and I like this because it's pretty straightforward. And it does give those notes on the site that I just mentioned about make sure you don't include the owners in the calculation. So I did an estimate here of 13 full-time employees with annual wages of about $455,000 you can do the math on that and divide it out. I think I used something like $7,000 as an average salary, or $5,000, whatever it was, and then the total annual employer premium contribution. Now, what's interesting, and you can roll over those little question marks and get a little further clarification, but I put on there, I estimated then $3,000 a month. So I assumed like 10 people took it. Maybe 3 of them didn't take it, but I've got 10 people that take it, paying $300 a month, 12 months. So you can see that it automatically gives you an estimation of the tax credit. Is $7,200 even, is that enough for somebody to care about? Many small businesses it would be. Now remember, with the small business tax credit, there is no electronic portal yet. Now they're saying that it should be available, well, I said this last year, it should be available January 1 of 2015. And I haven't seen anything updated on that yet to say yay or nay, it's going to go or not go. But remember, the big deal about this small business tax credit, or the SHOP program, right, Small Business Health Options Program, it was supposed to all be automated. They could go to healthcare.gov and click. Surely they have an estimator on that website as well, which is really funny because I went in there as I was preparing this presentation. I went to that website as well, to healthcare.gov, and did an estimator there, and I used these same exact numbers, and it says you don't qualify for an estimate. Or for a credit, rather. And it's like, okay. Anyway, so this one is by a company. It's called Small Business Majority. It's a company that is recommended on our HR Solutions website. If you haven't been out there in a while, that thing is so packed full of information. So that's where our team goes to get a lot of our information if we don't go directly to the carrier. But the KHI HR Solutions website has a great healthcare reform section, and I pulled this link, this company, off of their website. I think Aetna's got one. There's some other companies that have their own small business tax credit type calculators, but this one was interesting. And I don't know about you, but I don't know. The government can estimate, but ultimately it's tax law. So your small business owner's CPA is the one that's going to run through the calculation with them. So anyway, I felt pretty confident about this calculator, so this is the one that we're going to put up on our website for you to make it simple for you to access. The reason, again, that I bring it up is because I really think now's the time you want to be talking to folks. And as a reminder, the only 2 companies, as I was saying, that are in the shop, actually the only one company in Iowa is Co-Opportunity. There's Co-Opportunity and Coventry in Nebraska. But right now, Co-Opportunity is the only one in Iowa, and as you guys have heard, Wellmark's decision not to participate in the exchange in 2015, so we know that Wellmark won't be on the SHOP exchange in 2015 either. And so it is a Co-Opportunity health plan that you'd be recommending if a company is interested in the small business tax credit. But I'm telling you, you want to bring it up. You want to be talking to your small business owners about this, because whether they're your client or not, people are talking. The people that are serious and committed to health insurance in this market are talking to small businesses right now about this tax credit, about competitive rates. Co-Opportunity's got some great rates out there. If you're sitting on your Wellmark case and you're not reaching out to those folks because they don't have a renewal till 12/1, you're going to miss the boat. You want to get out there. You want to be talking to them right now. Generate a quote right now. Very soon we're going to know with Co-Opportunity, what their rate increases are looking like. So I think we got a heads up on some of that already. All right, so then this next thing that came up is this orientation period for purposes of a 90-day waiting period. And I think this, again, these are the things, the way I look at it is this might seem like, Lynn, why are you even sharing this? What's the big deal here? And part of me says, knowing this kind of information that you can share with a small business owner that their current broker, it may not be sharing with them. And if you are their current broker, these are the kinds of things that you want to just keep in touch with them to solidify your relationship. So let them know that the final ruling has come down. The orientation period for purposes of the 90-day waiting period limit cannot exceed 1 month. So what does that mean? Well, it means here that now group health plans can still be considered in compliance with the law as long as their orientation period does not exceed 1 month and in addition, really, the maximum 90-day waiting period. It will begin then on the first day after orientation period. So in essence, a small group technically can just buy themselves another month of waiting, especially, and I get this, and I know you guys do that have employees. Sometimes you just don't know if somebody's going to work out, and sometimes being able to offer them benefits within 90 days of their start date is a little aggressive. So if you have an orientation period where they're getting to know your company and you're getting to know them, maybe this makes sense. So anyway, I think it's helpful. And then they just do the little calculation here. What is 1 month? And so they're saying, and I think this is really because some months have 30 days, some have 28, 29, some have 31. What they're saying is here the 1 month would be determined by adding taking the calendar, and I think is the example here. If the employee's start date is August 31st, the last day of orientation would be September 30th. So just go to that next month. It'd be September 31. There's not 31 days in September. You subtract the day. And so that would be true any other dates of the month, but that would be their month, and then their 90-day waiting period would begin after that. So again, just good to know, and so I wanted to share that with you as this the final ruling came out, an explanation on it. We're obviously, and you guys maybe have gotten, hopefully got our email, our postcard, that we are just so proud to announce that we've been reselected as a Blue Cross Blue Shield wholesale distributor. And I want you to know that whenever the Wellmark name or logo is used, it has to look exactly like we have it listed here on the slide. That's a legitimate use of the Wellmark logo. We are not authorized to use the name Wellmark or use any of the branding material, or I should say just using the name or saying Wellmark Blue Cross Blue Shield without using the appropriate branded material. And so I want you to know that that was approved by Wellmark for us to send this out to. And anytime we use any carrier, that's true for any of our carriers, Coopportunity, Coventry, United Health, if we're going to use their logo, we get authorization from them to do so. So they approved this, and you'll be seeing some more communication from us, because I want to remind you of the Refer an Agent bonus for our agents and partners. We know that you are the best ones to know the right kind of agent that would be a right fit for KHI, and so we're offering a $500 bonus for any agent that refers an agent to us. We also got that approved by Wellmark. We are not able, and we have never done this, incented agents to come to us. We don't say, you sign up with us and we'll give you any kind of a bonus. We don't do that. But we are able to incent our current agents to refer other agents to us. So anyway, that's what that program is. If you have an agent you've talked to that may consider coming to KHI, remember the period of time. You should have probably all gotten this in your paperwork, but the period of time is between August and September 2nd for an agent to declare their general agency. As you know, also, everyone's going to have the ability to move. Even if their current agency got a contract, they're going to be able to move to another GA during that same period of time. And by the way, the information that you did get from Wellmark, I just want to clarify, that is not asking you to select a GA. That is just saying we want to recontract you, and by signing that electronic document, you're saying, yes, I want to remain in relationship with Wellmark. Yes, I want to sell Wellmark product. So that doesn't have anything to do with selecting a GA. That'll come a little bit later. As I mentioned, the period of time to select is August 1 to September 2nd. So that'll be coming up shortly here. So anyway, we're just thrilled, and so thank you for your support of us and for your support in going out to find any other like-minded agents that really put their customers first. Those are the kind of agents that we really want to partner with as we help you help your clients. So let's talk about fall training, and make sure that you kind of hold the date, and we'll be sending invitations out very soon so that you can RSVP back to us. I'm kind of working backwards here on our dates. We have our this year, Coopportunity Health is going to do something different. If you remember last year, they did several general sessions throughout the state, and they weren't agency-specific or wholesaler-specific or retailer-specific. They were just general sessions. Well, this year they're putting kind of a modified twist to that. They're going to travel around to the different areas, and they're going to have, or allow, I should say, each wholesaler to have kind of their own session in one location. And then they'll have that same day an afternoon session open to any agent. So, for example, on October 8th, KHI in Fort Dodge in the morning will have our KHI agent session. Now, can a KHI agent go to any other general session? Yes. I think what they're trying to do is allow us the opportunity to have that time just with you. So we'll have our agents geared on October 8th. If you can't make it and you need to go to another general session, that's fine as well. And that same day, they'll then offer an afternoon session to anybody and just open it up. I don't have the rest of their schedule yet, and that will be going out because they will be offering then the same idea with the other two wholesalers for Co-Opportunity Health in Iowa, which would be GBL and Mutual Med. So they'll be offering other sessions. For example, probably in Des Moines, I'm going to guess, that'll be a morning GBL session with an afternoon session in Des Moines open to any agent. And then likewise in the Iowa City, Coralville area, they'll probably do the same thing where in the morning session would be for Mutual Med agents, and in the afternoon would be open to any agent. So I know that they've identified those three locations, so the Fort Dodge, Des Moines, and Iowa City, Cedar Rapids area, Coralville, somewhere in there. Okay? So be watching that. We'll make sure we push that out as soon as we have them finalized. I know they were trying to lock on hotels and everything like that. So that'll come, but coming sooner than October is Wellmark's training, and we've got some dates and locations locked now on that. Erica was just working on that this week, got them finalized. We'll do 2 sessions for Wellmark on September 8th and 9th in here in Dodge at the Starlight, and then that consists of really like 6 hours. I've been talking to Kathy Gillespie, who's our brokerage manager at Wellmark. She's anticipating that the agenda will look something like 9 to 4 with a break for lunch. The topics to be covered are going to be things like what are their new products for 2015, both in the under 65 market as well as in the small group market. And then what are some of the Medicare changes? That's where it gets into the Part D stuff. I'm going to imagine that she'd have something in there as well with some healthcare reform updates as Wellmark sees it. So it'll be we're in 5 or 6 CEs. We don't know that yet, but it'll be a nice group of CE credits for those events. On September 10th, then we'll be in Storm Lake. Believe it or not, Kings Point was already booked, and so we got the college. And I know the parking situation can be challenging at BV, but there is that visit parking and a little bit of walk there, but that should accommodate us well, and they usually take really good care of us there on campus. And then September 11th, we'll be at Prairie Meadows. And September 15th, I believe and I'll confirm this, but I believe she got the Holiday Inn on 1st Street there in Coralville, right off I-80, and then go north on that exit, and the Holiday Inn sits back there. Colonial Life, we're going to be doing some additional continuing ed credits that we're going to roll out in August. So if you need, there'll be 2 credit hours offered with Colonial Life. These will just be morning or afternoon sessions. So like on August 11th, we'll be at Fort Dodge in the morning. And again, locations to be finalized. I think we were looking at a couple different venues there. And then in Des Moines, it'll be in the afternoon. So again, it's about a 2.5-hour session, but 2 hours of 2 CECs if you need that. And then we're going to take the road show over to Iowa City, Coralville, Cedar Rapids area, somewhere over there on August 12th. And again, more details to come. Continuing ed, we're coming to your area, and or if your assistants need continuing ed. So, okay, so that's a little bit of fall training there, and more info to come with invitations and RSVP. And then I want to also, kind of as we talk about fall training, and you know, goodness sakes, here we are again. We need to, if you're not registered, and some people didn't play in the care.gov last year, but if you want to, you need to get registered. If you've already registered, you need to really register again for participating in 2015. Now, that doesn't mean you have to set up a whole new account, log in, and all that stuff. You've already did that past year. You'll use that same information, but you actually do need to get registered and go through the testing again. It went live just Monday of this week. And what I want to show you is there's a really, really nice webinar that they have done, and I've got the slides to it. So I've asked our staff to get that posted onto our KHI Agents website. So if you want to go through the webinar on how do I get registered, I don't remember, and what about my IDs, and what's the time frame. So I just took a quick snapshot here out of that presentation just to kind of give you an idea. The training opened up, registering, I should say, opened up Monday. And then you'll notice here that you've got to get your agreements right. You got to test and get your certificate, get all that stuff done. And it looks like they're asking for all that done by September 30th. And then open, or I should say, excuse me, September 30th. If you'll notice that your agreements with CMS for this year expire. So you've got to get that done. And I'm just looking here to see open enrollment then obviously begins, so it runs from November 15th on, and so into next year, because it takes us through that open enrollment period, and then it has us available also for the special enrollment period. So anyway, but lots of good information. If you need more help with that, just contact a staff member at KHI. Again, I'm just trying to give you some high-level stuff. Make some notes of things you might want to follow up on either today or first part of next week to get done for you and or your staff. So that was really all I had, and I wanted to make sure we have time to open it up to some comments or questions, anything else that you want to mention. So hopefully we have everything set up so you can see the chat. You should be able to raise your hand. I know there were some problems with that last month, and I think we got that fixed. So I'll go ahead and look if you want to see if you raise your hand, and I'll see. Got any questions here or type of question? And I've just opened up your line, Howard. Do you have a question?
Thanks, Lynn. Can you hear me, Lynn? Great.
You
Okay,
bet.
so I just wanted to make a quick comment that FFM registration, re-upping for 2015, it was quick, it was easy. I got her done in like one day. So it's not a big deal. It's quick and easy. Go on ahead and get it done. And I'm looking forward to the Co-Opportunity Health deal in Fort Dodge there in October, so I'm going to check the emails on that, right?
You betcha.
Thanks.
Okay, well, thank you. Thanks for that comment. I think sometimes it is overwhelming with what we need to do, especially if you also play in the Medicare market. We know that all our AHIP certification and then all the carriers that you need to get recertified with, that's coming as well. So if you knock out some of this stuff as soon as it becomes available, I don't know about you, but sometimes I procrastinate, and then it's down to the end. So thanks for that, Howard. See if there's any other questions or chats. Looks like Brenda's got a question here. Let me see if I can get at it. Let's see, does the orientation period apply to both small and large groups? And the answer is yes. It applies to both small and large groups. Now, remember too, it kind of gets into this whole if I'm 50 and above or 50 and below. But the answer is whether or not you must offer coverage. If you do offer coverage, that would be applicable. So yes, the answer is it doesn't matter either size. And then it looks like another question here from Emma. Can we sign up for training if we have not decided yet where we are going to broker for next year? And I'm fine with that. I mean, we haven't sent out our invitations yet. As you guys know, if some of the training is happening in September, for example, with Wellmark, you're choosing to move your Wellmark, from A to B. I mean, I think all GAs are if you signed up, most likely if you're not going to be with, I'll just use this as an example. If you're not going to stay with KHI, you're probably not going to want to go to KHI's training in September because you will have made a designation about where else you want to go. But if you want to come, it's fine with me. It's, Wellmark training is going to be the same throughout. You probably get a little bit of spin from the different GAs, whoever you decide to go with. We hope you stay with KHI, but we understand you have a choice, and if it's not a fit, then we wish you the best. But gosh, we hope that we've provided great service and you guys will stick around. But yeah, if you haven't decided as of now and you need to RSVP, it's fine. Fine for KHI. I don't know about the other 2 days, but fine. If you're not sure or you're leaving us and you want to come to our training, that's fine. This is an interesting period, that's for sure. Let's see. We've got another question here. Let's see. Does Co-Opportunity offer any marketing materials for SHOP or tax credits for small business? And I know they've got their small business information, but let me take that down, Tom, and let me find out. I'm jotting a note here now, and let me find out for you, and I'll get back to you. And if you've got something, you know what, you guys, we'll push that out. If we've got some SHOP marketing materials, we'll just put that out in a news blast. And if you don't, but I'll get back to you either way, Tom, for sure. So SHOP materials from Co-op. Thanks. Good. And what was the website you referenced for the business credit? And that website, that's for calculating, I think, tax credit. That website, you'll find it on our website, and I just looked this morning. So actually, I'm going to take you there. Let me go back out to, let me get out to the web here. And let me get to KHI Agents. So hopefully you can see this okay. When you go out to on the KHI Agents portal, and by the way, if you still don't have a login, just call one of the staff, because it's super simple. It's like your email address, and I won't say anything else, because just I think, because I don't know for sure, but I forget if there's a deep password that we give everybody. So just give us a call to one of the staff. But then you go to resources and click on healthcare reform. And then when you run down here, it's right here, the Small Business Healthcare Tax Credit Estimator. And so let me just go there and make sure that's the one that I talked to you about. Yep. And then what is the estimator? And then click the credit, and let's see, where's the link? Use the estimator. Sorry, you guys are going to probably see it here before I do. Okay, what's the credit? Where's the? All right, you guys are, I'm serious, you guys are probably going to see it before I do. So it asks you how you do it, getting started, blah, blah, blah. Click here to begin. There we go. Duh. You know what? This is a different one than the one. I just asked Nikita to put a different one on the website. So hold on. It'll be on this same place, though, right where I showed you. It'll be right here under our healthcare reform link, under insurance, or excuse me, other solutions. Whoops. Where'd it go? There we go. Resources on healthcare reform. So just scroll down to the bottom. It'll be right here. I'm going to replace this one because I like the one that I just talked to you guys about this morning. I just sent that to you this morning. Okay, let's see. Let me go to another question here. Can we do marketplace training without having designation? I guess I asked, sorry, I got that one already. Let me scroll down. And here's another question. Do you know if Coventry or Aetna will be allowing their grandfathered individual policy to continue into 2015? That's a great question, Craig. I haven't heard for sure that they will, and maybe somebody else has. If somebody else has, feel free to raise your hand or type in under the question section. Let me check and see if we've got any more hands raised. Maybe somebody's got a thought for us. And I see, I'm going to open up Frank's line, Olson. Go ahead, Frank.
Well, good morning, Lynn.
Good morning.
In reading the blue briefings this week, could you expand a little bit on the preventative tobacco cessation drug coverage and also the mental health things that looks like have been finalized?
Yeah, in fact, I was just reviewing that this morning, and I didn't put it in my presentation. Just looking at it, it really is drilling down into each of the different products. Let's see. Let me go to. I think I had in my inbox. I think I had the blue briefing right here. So let me just open this up real quick. And so what Frank's referring to is, let me just pull this up. It's going to make me log in again. Nope, it got me. Okay. So it talks here about, here's the final rules for implementing mental health parity and the Addiction Equity Act, and also the ACA changes to the preventive tobacco cessation drug coverage. So, and this, of course, coverage, it talks about effective August 1st. So let me get this over here on the screen so we can see it. So let's just kind of talk here real quick. So it's talking about, here's for groups currently applying ACA preventive services. So again, that's the non-grandfathered and ACA plans, right? So it looks like here the member cost share will be waived for prescription tobacco cessation drugs as well as over-the-counter drugs for up to a total of 180 days benefit year. So what it's interesting there. So that's talking about the non-grandfathered and ACA plans that have the preventive services. So again, it's just saying here the cost share copay is going to be waived for up to a total of 180 days benefit year. So then I look down at, so we figure what that's, how many months? That'd be 6 months, right?
Yes.
So it's 6 months. So then I'm going to look at self-funded and fully insured 51 plus. And so now it's saying the 180 days benefit year prescription and prescribed over-the-counter drugs are covered with no member cost share. But after the 180th day, then current group benefits for these drugs apply through the end of the year. So then they would have their copays. Okay. Now it does say here, notice too, and then it says copays will apply and over-the-counter is no longer covered. So they'll get that covered for the first 180 days of the plan. And then you notice here that just the clarification on individual and small group non-grandfathered plans. Benefits for tobacco cessation drugs will end when the 180 days are consumed. So I don't know if that's, it just kind of to review that a little bit, Frank, if that helps.
Yeah, so it doesn't affect the grandfathered plans.
That's correct.
Both individual and group.
That's correct.
Okay.
Okay, and then I was going to see if there was something here about the mental health you asked about. Let me go back. Yeah, it's good sometimes just to go. I know we get so much information, so just to set this time aside where we can kind of go through it and look through this stuff. So here's the final rules for implementing Mental Health Parity and Addiction Equity Act. So I had not seen this one yet. I hadn't really looked at it. So let's see what the impact on the essential health benefits is, because that's how it really relates to the Affordable Care Act. So we're looking here. So it's saying whether grandfathered or non-grandfathered, the final rules apply to group health plans and individuals. So this is the impact. And it's looking like, sorry, I'm just reading this here, that under the essential health benefits rule, individual and small group ACA health plans are required to comply with these parity regulations. And although well-marked small group grandfathered plans were not required to comply, changes were already implemented under the interim final rules and these final rules will be applied. So let's just kind of see what the summary of the clarifications are. So non-quantitative treatment limitations versus intermediate level of care. Wow. I'll just tell you right now, there's a lot of this I don't drill down into this deep. So let me leave it this, that you know that this is out here. If you've got some questions as it relates to some of your specific group cases and clarifying this, if there's some concerns here, get a holler out to one of our staff and we'll go through it.
So one other question on this, Lynn. can we find out what percentage of increase this will affect the renewals? You know, if a renewal is at 5-6%, is 1 or 2% of that increase due to these implications?
Yeah, that's a good question, Frank. And specifically when we're talking about this mental health parity stuff, I'll put the question in and ask, but I'm going to think it's pretty small. But let me ask Frank to see if it even is a blip on the radar, or if it really makes a difference. But let me find out. Okay.
Okay. Thank you.
Let me go here just a sec. Okay, see if we've got any other hands raised here. And let me just check and see if we've got any other questions. Here's another comment, maybe your question. Maybe you can mention that IHU is also going to be holding for all 4 carriers on the same day. Des Moines will be August 8th, Lake on September 16th, and Cedar Rapids, rather, September 18th. 4 CECs for each location. Thank you. I bet that was Marcy. Well, actually, let me mention another thing. I meant to put it on my presentation, but don't forget, too, in July, coming up here is the Health Symposium, July 23rd and 24th at Prairie Meadows. It's going to be a phenomenal day, and it's really, KHI is one of the sponsors of the event as well, along with a lot of other folks that we've got some great support, and it's going to be the place to be. If you sell health insurance and you want to be in the know, this is the place you want to be. And if you can't go, make sure you get somebody that you know that's going, that you can do a debrief with them afterwards. There's going to be some fantastic speakers there. There'll be at least, I think it's 15 credit hours that you can get if you need the CECs by attending those 2 days. So that'll be fantastic. And then the other point here, I think Marcy was just making, that health underwriters, and again, here's my point for health underwriters. If you are not a member of health underwriters, healthcare is part of your core business, you really need to, we need your support. We need your membership. And call me, because we've got a little discount program. We can list bill it through KHI. We can take it out of your conditions on a monthly basis, or you can write us a check, but we can secure you a discount. And the more people I get, the deeper the discount I can get for you. Right now, it's only at 3%, but it can go to 5% up to 10%, and get you guys a little bit break on that. And really, it's not expensive. $375 a year. And as I've always said to everybody, that's just a hair over $1 a day to support this industry. So the symposium is sponsored by the health underwriters. As you guys know, I serve on the board for health underwriters as their membership chair. And then what Marcy's talking about doing is, and we're really excited about this, is carriers want to get out in front of you guys as often as they can. And so Health Underwriters has lined up a program in September. This is continuing ed credits, as Marcy's saying, but or as she's written, but it's also a time for you to give feedback to them. And I think sometimes we miss that forum. When you come to the Wellmark training that I was just talking about, that KHI's hosting and the other GAs will host all over the state for, the new products Wellmark's going to have, and there's really sometimes not a lot of time to get that, share your feedback with them about what's going on. So this is an arena where I love that Health Underwriters does this, and this was Marcy's idea to bring all 4 carriers together, the main carriers. So you have Wellmark, Opportunity, Coventry, United Healthcare, all in the room at the same time. And they'll go one right after the other. And so it's an opportunity for us to get in a really intimate setting. So you're right there talking to folks and giving them feedback and asking questions. So great point, and I bet that was actually Eric that said it, but thank you, Eric Polsdorf. I appreciate that. So once again, I'm going to do these dates quick. These are the ones that'll be, and and hopefully it's on our website, our Health Writers website. You go to eiahu.org, and you can get the dates, but let me just give them to you real quick. So it looks like Des Moines, August 28th, Storm Lake, September 16th, and Cedar Rapids, September 18th, 4 CECs for each location. And then Eric also says at the symposium, Avik Roy is worth it alone. That guy, he spoke last year. He's coming back. He's just a wealth of knowledge, and that's where he's speaking, is at the symposium at Prairie Meadows in just a couple weeks. So, okay. Let's see if there's any other questions or comments. Raise your hands if you can. Chat question if you want to. I'll look through here again and if I see any other hands raised. Any other comments anybody has? Let me look at the questions here again. Okay, I'm not seeing any. Well, it's about 9:41, and if no other questions, I just want to thank you guys for your business, and thanks for jumping on these webinars with us. Appreciate it. We're going to keep going. Frank says we're going to keep doing these, and so every month, I know some of them, if you feel like they need to be offered more frequently, I feel like monthly is enough, but give me your feedback. Sometimes there's not a lot of changes to go on, but I like having this time where we come together and bring us all up to speed. So, all right. I guess I don't see any other questions, and I don't see any other hands raised. So with that, have a wonderful weekend. Have a good Friday, and I look forward to talking to you real soon. Take care, you guys. Bye-bye.